Assalamualaikum warahmatullahi wabarakatuh. First, let me introduce myself. My name is Sutra Guru Mega with NPM H1A020067. Right now, I'm gonna explain about Ali Mansouri journal about the effect of garlic and cumin on blood pressure and glycosylated hemoglobin in patients with type 2 diabetes. So first, what is diabetes mellitus? Diabetes mellitus, or is known as type 2 diabetes, is one of the most common metabolic disturbances associated with increased blood sugar, metabolism of carbohydrates, lipids, protein, and relative or absolute insulin depression. According to the World Health Organization estimates, the number of affected people will increase from 171 million in 2000 to 366 million in 2030. And type 2 diabetes involves 95% of the subject. The second is, what is the relation between blood pressure and glycosylated hemoglobin with type 2 diabetes? Hypertension is seen in 70 of diabetic patients. The risk of developing diabetes is 2 times higher in people with high blood pressure. Of the 1,500 diabetic patients examined by Danish researchers, 51% of patients with type 1 diabetes and 80% of type 2 diabetes patients had hypertension above 90 to 140 mmHg. Third, why is herbal treatment needed? Chemical drugs used to treat diabetes have observed side effects. Insulin is one of these medications that can lead to complications such as lipohypertrophy or lipoatrophy. Before the discovery of insulin as well as common anti-diabetic drugs, diabetic patients were treated with medical herb and traditional treatment. Over the past 10 to 20 years, laboratory and clinical studies have been carried out on plants used to treat diabetes, some of which have significant effect on the reduction of blood sugar and blood pressure. So, what kind of medical herb that can be used? One of the herbs that will probably help in the treatment of diabetes is cumin. Cumin. Cumin is called cumin seed in English. In traditional drugs, cumin is used as anti-obesity, anti-convulsant, anti-epileptic, diuretic, and stomach booster, and has recently been considered as the anti-diabetes drug in some studies. There have also recently been reports on the anti-diabetic properties of garlic, and it has been shown that acetane in garlic, such as insulin and glibenclamine, has been shown to reduce blood sugar levels. Studies have also shown that garlic oil and its compounds such as dilithium sulfate can improve blood sugar level in diabetic rats. The aim of this research, since there are no specific drug interactions associated with the use of cumin or garlic in combination with hypoglycemic agents and blood pressures, hence the present study was conducted to investigate the effects of garlic and cumin on blood pressure and glycosylated hemoglobin in patients with type 2 diabetes. Next is the materials. 75 patients with type 2 diabetes who entered the study were randomly divided into three groups. With the first is 25 in intervention group or with garlic consumer, 25 other in intervention group cumin consumer, and 25 other is in control group. The inclusion criteria for entering this study include: first, type 2 diabetes of at least 6 months of diagnosis; 2, hypertension above 140 90 mmHg; 3, the ability to speak; 4, lack of psychological disease; 5, non-insulin therapy; 6, have a single drug schedule in terms of type of use drugs; 7, non-pregnancy and breastfeeding; 8, lack of use extract of cumin and garlic; 9, not using tobacco or alcohol; and 10, the last is hemoglobin A1c higher than 8%. Next is the method. Initially, after explaining the goals of the treatment to the patient and obtain written informed consent, a general information questionnaire was obtained and completed through interviews with each of the patients, including demographic information and disease information, or the duration of illness, signs associated with illness, search of information, consume drugs, and then the hemoglobin A1c and systolic and diastolic blood pressure were measured in all three groups. Patients were told to rest at least half an hour before measuring blood pressure and not to drink tea. During the measurement of the patient's blood pressure, they were placed in a sitting position, and the patient's hand was maintained at the same level with his or her head at the examiner's hand. At the first visit, blood pressure was recorded from both arms. In the case of pressure differences, the higher blood pressure was considered as the blood pressure of the patient. To measure hemoglobin A1c, a blood sample was taken and sent to the lab, and then give capsule. The intervention group got 300 mg capsule of garlic powder and the cumin capsule. The capsule is consumed after breakfast, lunch, and dinner meals. The control group got capsules too, but the placebo without contain anything. All patients received training on diet, activity level, and drug regimen. The principles of treatment were emphasized daily through text message to patients. Patients were also examined in terms of drug side effects and compliance with diet, drug, and activity level, and were excluded from the research if they did not follow any of the above items. 2 months later of the start of the study, blood pressure and hemoglobin A1c were again measured in all three groups. And this is the result of the research. The mean systolic pressure in the cumin consumer group was lower than that of the garlic and control group and statistically significant. On the other hand, The mean of systolic pressure after intervention in the garlic consumer group was lower than the other two groups and saw the statistically significant differences. The mean of hemoglobin A1c was also lower in the cumin group than in the other two groups, and this difference was statistically significant. So the conclusion is the result of this study showed that there's a significant difference between the mean of hemoglobin A1c in the three groups of the garlic, cumin, and control group. Also, the difference in mean systolic and diastolic blood, blood pressure showed a significant difference in the three groups of garlic, cumin, and control. In the present study, cumin positive effects were observed of the improvement of hemoglobin A1c level and blood pressure. Also, taking 3 servings of 300 milligrams capsule of garlic improved blood pressure in diabetic patients. Accordingly, it can be said that supplementation of garlic and cumin can be useful in controlling complication and treating diabetes. Okay, that's enough for me. Thank you for your attention, and I'm sorry if I get a lot of misspell. Bye bye and see you later. Wassalamualaikum warahmatullahi wabarakatuh.